All right, go for it.
Okay. Hi, everybody. My name is Danielle Randolph, and I am an advocate with the law firm. Thanks for hanging in there in day two. I'm almost done with day two, but we've had some great presentations today, so hopefully everyone's enjoyed those. I had to grab myself some coffee, so hopefully you did the same if you're an afternoon coffee drinker as well. A fun fact about me, I am a mom of four. I homeschool all four of my kids, and so we are busy. All four of my kids are also in soccer, so we are really busy in the fall and springtime. Just to give you a physical description of myself, I have brown hair that's pulled back into a bun. I have glasses, a navy dress, and a white necklace. So today we're going to be talking about applying information from your evaluation report to the IEP. This is not state specific, so any education evaluation report that you would have in your school district, we're going to be talking about today and really diving deep down into the details of those evaluations. Looking at different assessments, criteria for qualification, and then we have some scenarios at the end on really applying that knowledge to IEP goals in advance. Thank you. So typically when we have an assessment done through the school district, especially if it's an initial evaluation or your student's first one, there's going to be a cognitive assessment that's performed. And this really is to just look at the way your brain functions. It's important when we think about children in school, trying to figure out their learning styles and how best to approach their differences. We want to really see their strengths and weaknesses cognitively. On the screen, these are 7 areas that are typically assessed. Not all of the time because we have different cognitive assessments that are used in schools, but most of the time you're going to see either most or all of these areas. And we're going to look into these a bit more in depth on these next slides. So the first one is verbal comprehension. This is really looking at language development, background knowledge, vocabulary, similarities, and differences. So really looking at the language part of the brain and understanding language. There's a high correspondence with verbal comprehension and reading and writing. And if this is a strength of yours or your child, typically we would see strengths in comprehending reading material, understanding vocabulary terms, learning new languages, and writing or written expression. Weakness in this area would be would mean that those areas that I just talked, oh, you're fine, you're fine. Those strengths would be weaknesses, right? So if this is an area that is not so strong, then you're going to struggle with reading, writing, and understanding those new languages. So we sometimes see students as they get older that really struggle with the foreign language requirement in high school. Now you can move forward. Thank you. Another area is fluid reasoning, and we look at this as problem solving. So whenever you're introduced to a new or novel problem, can you figure out the solution? Can you use inductive and deductive reasoning to find the answer? If we think of 20 questions, right, the game 20 questions, so trying to figure out what that item or person is by questioning and looking deep into maybe what that person is thinking of. So that fluid reasoning is really utilized for that. I'm looking at how things are alike and different. So again, the similarities and differences between the fluid reasoning and verbal comprehension are similar, right? But when we look at fluid reasoning, a lot of times we're talking about visual things. So if I, had a list of 4 items and one was different, being able to pick out the different item, even if they're just slightly different. So sometimes those I Spy books or things like that can really have these skills highlighted. There's a high correlation with reading comprehension, math, and writing when we look at fluid reasoning. If you have a strength in this area, then that means you're probably good at Sudoku or word puzzles. Again, being awesome at 20 questions or guess who. That's a game that my kids like to play. Maybe your strength is in algebra, engineering challenges, and STEM subjects. So fluid reasoning is really important for those higher level engineering, math, science classes. And so usually we see a high correlation between strengths in those areas. Next one. Visual spatial abilities. So this kind of goes along with fluid reasoning, and we usually term these two together as nonverbal skills because you're not really looking again at that language component, and a student can perform well on these tasks without using their words. So these would be nonverbal skills. Visual spatial abilities are hand-eye coordination. So being able to, I think about babies, how they used to have those like cubes with the little pieces that had different shapes. So that would be visual spatial abilities, right? Being able to know how to turn those little shapes into those little, pre-cut openings. But that's using visual spatial abilities. Being able to analyze and assess visual information, being able to mentally manipulate visual information. So being able to see something and knowing if we turn it 90 degrees, what is it going to look like? This is highly correlated with math, especially geometry. Understanding directions and reading maps. So understanding your person, your where you are in space and how that correlates to where you want to go. Renee and I were just together on Monday, and I told her that I am challenged in this area, that I often get lost. So my visual spatial abilities are not very strong. But if they are a strength of you or your child, then that means that understanding architectural design could be something looked into. You're usually amazing at Tetris and Rubik's Cubes. You never get lost, and good at geometry and puzzles. Long-term memory storage and retrieval is another area that's assessed with cognitive assessments. And this is being able to remember information and retain it for the long haul. So when you're sitting in the classroom, you're learning about a new subject or new topic, being able to retain and store that information and then pull it out later, whether it's a test or whatever it may be, but being able to store it and then retrieve it when you need to. It's being able to be awesome at remembering things. So this is really a great strength for a lot of people that, again, they like to learn new information. You see like people on Jeopardy, right? And they can pull out random facts that they've known all along and be able to use that information. So that's a strength in the long-term memory and retrieval. Short-term memory and working memory, sort of similar to the previous one, except for it's a very short period of time. Usually short-term memory, you're looking at less than a minute. So it's being able to hear or learn something and either use it immediately or store it away. Mentally working with new information. So if you ask somebody for their phone number, they give it to you, being able to do something with that information. Or you know how you always you log into something and it gives you those silly codes. I feel like I get a code all the time for things. Being able to see that code and being able to use it immediately. Being able to remember instructions to complete a task, especially again, if we think about sitting in a classroom, if a teacher's giving 1, 2, 3 step directions, being able to hear it, comprehend it, and then do those tasks that are being asked of you. Being able to chunk information. Sometimes if you're talking to somebody and you're going to the grocery store and you ask, what do I need from the store? And they give you a list of 5 different things or 6 different things, being able to even chunk that information into like produce or meat, just to help your memory store that away. A strength, if this is a strength of yours, would be following this multi-step direction successfully, doing mental math, remembering where you left off in a book, and remembering names and phone numbers. Processing speed is something that we really value in school because we expect people to do things quickly and efficiently, and that's having good processing speed. We know that sometimes people do struggle with processing speed and then they need that extra time, that extended time to complete tasks or tests. But if this is a strength of yours, then you could be really great at speed reading, or being able to finish tasks quickly. Math fluency or reading fluency tasks would be a strength of yours. Being able to make quick decisions and thinking on your feet. That's being able to process information quickly. And then the 7th area is auditory processing. This is an area that is really only assessed on one cognitive assessment, so you may not see it very often if you have a student that's being evaluated, but this really dives really deep into the auditory skills of your student. It's being able to understand verbal information, having strong phonological skills. So when we look at those sort of foundation skills that students need for reading, like letter sounds, letter ID, rhyming, we're really tapping into that auditory processing. And it's making that connection between how the brain processes and codes what it hears. So not only being able to process it, but again, storing it away so you can then conceptualize where those sounds go and making sense of those things. This is the #1 cognitive process that is linked to dyslexia and phonological awareness. So it's a really important piece to the puzzle if you suspect your student has dyslexia. A strength in auditory processing correlates to reading and spelling and understanding verbal directions because, again, it's a verbal skill. So we just went over quickly the 7 areas of cognitive functioning that we look at when we're trying to decide strengths and weaknesses, trying to look at different avenues to explore when it comes to IEP development. When we have assessments or evaluations in schools, again, we look at cognitive processes, but we also look at academic achievement. And that could be through a formalized evaluation, but we also have a lot of curriculum-based measures that are done in schools nowadays, a lot of classroom samples that can be pulled into the evaluation. But I wanted to look at the academic areas that qualify specifically for that special design instruction. So when we're looking at qualifying on that evaluation and we talk about what are goals going to be on the IEP or what specialized services do students need to qualify for based on that evaluation, that's what we're going to talk about in these next few slides. So the big 6 that we look at are basic reading, which is that decoding. So being able to take a word and be able to read it, right? Sometimes that's being able to read it by sight, like the word the, for instance. You can't sound that out. Our eyes and our brain can really just track that word and know that it's the. But it's also being able to break those down into the phonetic coding. So being able to sound out those consonant vowel consonant words and whatnot. Reading fluency is reading quickly, but it's also reading quickly and efficiently, right? So it's being able to read and pause where it makes sense to pause. Reading comprehension takes those 2 reading skills and then it builds upon them by saying, can we understand what we read? So basic reading is reading the words. Reading fluency is being able to read at a nice, easy pace. And the reading comprehension is being able to understand what we read. So all 3 of those really do go hand in hand, but they're important to any student who's going through school. The 2 areas of math that we look at are math calculation, which is just really your basic math facts. Also kind of getting into the algebraic equations or long-term division, but it's really just that quick math computation. And then math reasoning, so looking at math problem solving, story problems. So being able to take a math problem, knowing how to calculate it based on understanding the math vocabulary that's involved in it, being able to read it, or if it's read to you, being able to understand what it's asking you to do. So again, taking that math computation, but incorporating that higher level skill of reasoning. And the written expression. I'm so sorry, written expression. And so that's being able to just write and write whatever is being asked of you. So if there's a topic that you're writing on, being able to follow the topic, being able to organize your writing, looking at capitalization, punctuation, spelling. So that all kind of gets wrapped into the written expression. Yeah, you can see in the big 6, we don't have spelling. Spelling is not a standalone area necessarily. Can you have an IEP goal in spelling? Sure. But when we look at qualification or special design and instruction, spelling is not an area that by itself qualifies, especially when we're looking at a specific learning disability. These are really the areas we're looking at, and spelling is not included. There are 2 more that I feel like are often ignored or glossed over, and those are listening comprehension and oral expression. If you look at paperwork for qualification, these are 2 areas that can be checked for specific learning disabilities, but oftentimes if a student is deficient in one of these, it's going to be worked on by the speech and language pathologist because receptive language is very similar to listening comprehension, and expressive language is very similar to oral expression. And so I don't often see an IEP goal worked on by a special education provider in either of these 2 areas. Usually would be an SLP. However, I did want everyone to know that those are 2 areas that you could qualify for special design instruction, and they do qualify under SLD if we're looking at that qualification category. Next slide. Thank you. So now that we've talked about different intellectual abilities with the cognitive scales, we talked about academic achievement and looking at those areas of qualification, I wanted to spend a couple slides, a few minutes on qualification basics, because this is something that as an advocate, I oftentimes will speak to my clients and to parents about qualification, because I'm a parent myself, and if my child was struggling in school, I can see why, why it would be difficult to interpret assessment data and think to myself, well, why is my kid not qualifying? Why don't they qualify for this goal or even qualify for special education to begin with? And so I just thought it would be helpful for me to outline the qualification basics so everybody kind of knows what the school psychologist or speech and language pathologist is looking at when they look at this assessment data. So if we think about a bell curve, which I thought to myself after the fact, I probably should have put a picture of a bell curve in here, but I didn't. So if we look at a bell curve, it kind of goes like this, right? So we have 100 being exactly in the middle of that bell curve. 100 is average, spot on average where you should be on that day for your age. And on that bell curve, we have an average range, which is between 85 and 115. So again, 100 is average, 85 to 115 is average as well. That's the range. 85 is one standard deviation below average. So we look at that standard score usually as kind of a black and white buffer. A lot of schools are not going to qualify a student for services or for a goal if they score above 85 on a standardized assessment that uses standard scores. So usually we're looking at anything below 85. That doesn't mean that a school might look at an 83 or an 84 and say, nope, they don't qualify. And sometimes that's because of the test manufacturer and they use 80 to 85 as low average. I disagree with that terminology. I don't think that's low average at all. But sometimes schools will even use that 80 to 85 range and say that they don't qualify because it's not below enough. It's not low enough. Which, again, I'm sure all of you are probably thinking that's absurd because it truly is. 85 is usually, in my opinion, you're looking at about a grade and a half below average if your student is scoring an 85. That's just a rough sort of opinion estimate, but based on my 10 years of being a school psychologist, that's usually what I would see. Percentile ranks. So on that bell curve, 85, it's actually 16%, the 16th percentile. But a lot of schools will use 15 because it's a nice, easy, sort of evenish number. So usually percentile scores below 15% is what's going to qualify, which again, that's pretty low, right? I mean, that's saying that 85% of people are scoring above you. So that is pretty low. But again, special education is not for everybody. So it is supposed to be for those students that don't respond positively to interventions and just, aren't doing well with the general curriculum and services that are provided to all gen ed students. So it is supposed to be a little restrictive, but sometimes, in my opinion, 15% is pretty restrictive. Some assessments use T-scores instead of standard scores or percentile scores. And so anything below a 30 or above 70, depending on the assessment, is considered clinically significant, and that would qualify for services. And we're going to go a little bit more in depth into different assessments and the scorings they use, but again, just kind of giving you a broad overview right now. If you have a district that uses the strength and weakness model to qualify for special education, especially looking at that specific learning disability category, you really have to have strengths and weaknesses, and they have to be pretty well documented with the assessment tools that were used. So you have to have some cognitive areas that are within the average range or even higher, and some that are below average. And the ones that are below average have to match up with the academic weaknesses that we would expect them to. So for instance, visual spatial skills. Sorry if you hear my dogs. It's summertime and we've got kids coming and going. Visual spatial skills and math reasoning deficits go hand in hand. Auditory processing and basic reading weaknesses go hand in hand. So like I had explained with the cognitive abilities before and how we have strengths and weaknesses that are tied to each of those, that's what a school psychologist is looking for. So if the student, scores below average in visual spatial skills, then we would expect that math is going to be an academic deficit. If math isn't an academic deficit, and let's say written expression is, those two don't tend to go hand in hand. They don't have that relationship typically. And so your school psychologist might even question, is that truly an SLD? So just some things to think about. I think on the next slide, I have maybe a few other examples. So processing speed, short-term memory, and long-term memory, those affect really all areas of academic functioning. Again, processing speed is just being able to process all things, right? Short-term memory is being able to learn and work with information in the short term, and long-term, of course, is being able to store and use later on. So those really do cross all subject matters, and they aren't specifically tailored to one academic area. So those really could qualify for any of those areas. And it's very common for students with ADHD to exhibit differences in the three areas that I just listed, especially processing speed and short-term memory, because you have to have good attention to be able to remember things, right? Especially in the short term. So a lot of times when we're evaluating for students with ADHD to see if they have ADHD or to see if they qualify, in Ohio, you don't have to have a medical diagnosis. So sometimes school psychologists will evaluate and see if they qualify for other health impairment because they may have characteristics of ADHD. Anyway, that was a long way of saying that we really want to see that pattern. And so if we see the processing speed and memory deficits, that really does kind of align with what we'd expect for a student who has ADHD. All right, so this is my poll question, true or false? Spelling is an academic area that qualifies under the category of specific learning disability. All right, so it is false. Again, spelling is an area that could warrant a goal on an IEP, but it's not a standalone area that can qualify for services. Sometimes we see, districts write a goal that's encoding and decoding because they do typically work on the same skills. So that's a way for us to qualify for spelling if the writing's okay. But all right, we're going to dive into dyslexia specific assessments. So I think that dyslexia is I don't want to say a current topic, right? I mean, kids who they've had dyslexia for, decades. But it is something in the law. Ohio, passed a law years ago. Michigan has recently passed laws as well, where we're really looking at, students being assessed at the kindergarten level for dyslexia. And we're using curriculum-based measures to really see who is at risk for dyslexia and being able to intervene early, which I think is just fantastic. Because a lot of times, if we get interventions in there early, they may not need an IEP. They may not need special education. But if we're looking at dyslexia and that's a concern, there are some specific assessments that I, as an advocate, will typically ask for. So I wanted to introduce those in these next slides. So when we think about dyslexia and dyslexia, sorry, misspelled that one. It's ironic. When we think about dyslexia, there are specific areas that we think about that are going to impact a student's success in school. And some of those might not be ones that you would think of when we talk about dyslexia. The first one is rapid naming. So being able to retrieve information, especially words, being able to retrieve words and information quickly. So in some of these assessments, it's going to be, list in a minute, list as many animals as you can think of, or list as many foods as you can think of. Sometimes it's just honestly a list of letters. How quickly can you name these letters in random order? So that's an area that we look at for dyslexia that, again, like I said, isn't often captured in some of these other assessments that are being done. Short-term memory is, in my opinion, sort of surprising, but there is a correlation between short-term memory and dyslexia. And it just is the different parts of the brain that are impacted by dyslexia that we see correspond to some difficulty with short-term memory. Phonological awareness is one that we would expect, and that's looking at segmenting, blending, and rhyming. So being able to take a word, break that word down into sections, but also being able to blend the words together. And then rhyming. Rhyming is honestly one of the first areas of concern we see with our kindergarten or even preschool students. But at kindergarten, that's one of the screening tools that are used being able to see if they can rhyme, because it's again really using those audiological skills to really apply to the reading. Decoding real words and nonsense words. So, of course, decoding real words is important, but sometimes students can memorize words. So, being able to give them a list of nonsense words, it allows us to see, can they decode words? Do they know the letter sounds and how to blend those letter sounds into words, even if the words don't make sense? And sometimes when I used to assess kids, I would notice that there would be a nonsense word and their brain would read it as a real word, and they would substitute that as a real word that is closely spelled. But we really want to see the nonsense word decoding it and see if that's impacted. Spelling, of course, we know encoding, decoding do go hand in hand. So being able to spell is something we want to look at for our dyslexia assessments. And then weaknesses in multiple areas listed above would correspond to goals in reading, basic reading, and spelling minimally. So if we see that these areas are deficient and the student is really struggling in these areas, then we would see on the IEP a basic reading and spelling goal. Like I said, sometimes schools will lump them together, especially if they're doing some sort of Orton Gillingham or Wilson reading program. A lot of times they're going through the same steps and they're focusing on reading and spelling together. And so it would make sense we would have one goal addressing them. Next, we're going to talk about some other areas that are evaluated. So we look at social emotional learning and executive functioning skills whenever we're concerned that a student, again, might have ADHD, if they're struggling with any sort of behavior or mental health. Usually we're going to look at different rating scales to assess these areas. And most of those rating scales are going to use T-scores. And so the average range on these assessments is 40 to 60. That's really just your average range. Think about it as your 85 to 115. Scores between 30 and 39 or 60 and 69 are considered at risk or mildly elevated. Schools don't typically qualify students when they have scores that fall in this range because it would be considered, again, at risk, something we should keep our eye on. But it's not something that's clinically significant, like if it were below 29 or above 70. Those are really when it's like, okay, there's really something going on here and we have to address it. And that's going to correspond to goals on an IEP, accommodations, or modifications on a 504 plan. Autism-specific rating scales also fall into this category. A lot of times we're using rating scales that are going to have T-scores. Sometimes you'll see standard scores as well, which we went over at the beginning. But again, same thing applies. Is this average range, anything outside that average range that's going to be 1 to 2 standard deviations below average or above average is really where we get concerned and we know that they need some services. Adaptive behavior rating scales are usually in standard scores, so that average range applies. Typically, teams want to see scores below 80. So again, they want to see the most impactful to their education. And so below 80 is usually what we're looking at. So somewhere, 70s or below. However, a lot of times the adaptive behavior assessments will overlap with other areas that are already being assessed. So the adaptive behavior assessments look at academic achievement. They look at language. They look at different social, emotional, executive functioning skills. They look at social skills, motor skills. So a lot of times it can be redundant, but sometimes it's helpful for thinking a student might need an adaptive behavior goal, or we really just kind of want a second look at some of these areas that we're already assessing. Social skills, leisure, health, and safety. Those are ones that are not always covered by other assessments, and those could result in services strictly based on this assessment. So that's, again, could be important depending on the student and what we're looking at. Communication usually use standard scores, so anything below an 85 would qualify for services most often. Like I said, sometimes they're a little picky. But these two questions I put in there are because this year I've ran into a couple different situations where a school wouldn't qualify students because the student maybe scored really well on the speech and language assessment, but we were saying, hey, they can't apply that in practice. They can't have engaging, conversations with other people. They're not initiating conversations when they are in school. They're really struggling with being able to problem solve in social situations when it comes to that language component. And so, what about those students? How do we advocate for those students to get services? And then how about speech intelligibility? I had an SLP that said a student didn't qualify because they were intelligible. So their speech articulation sounds were poor, but we could understand them. So sometimes we can't just take the scores and just take these assessments for what really for their face value. We have to say or ask the question, how does that impact them every day when they come to school? I just wanted to put that thought in there. Motor assessments, usually again, T-scores or standard scores. So as you see, a lot of these have similar score patterns, which I think is helpful when you're looking at an evaluation and trying to interpret the data, that a lot of times these rules apply to all the assessments we're looking at. But when it comes to qualifying for occupational therapy or physical therapy, the skill deficit really has to impact them in the school setting. So a lot of times we have parents that are concerned about tying shoes. Well, they don't have to tie shoes in school, right? So they're not going to really qualify for a goal for tying shoes. However, navigating playground equipment, being able to walk around the school building, even buttoning and zipping, because that's an independent life skill. Those are areas that we would see maybe qualifying for services, or writing, cutting, copying, things that are academic in nature. Those are going to qualify for services. So it's again really that impact on their education, on their school day, on their independent living skills within the school setting, and those are going to qualify for those services. Adaptive physical education, a lot of times there are separate assessments for that. I don't really know what those are, but a lot of times if you're looking for adaptive PE, that's going to be a separate assessment that you would want to ask for at the planning meeting. So some last additional thoughts on qualification. Because again, I don't know about other advocates or attorneys that work in education law, but we sit through a lot of evaluations with a lot of different schools. And it seems to be that schools prioritize the school forms. And that's always hard for a parent to sit with because they know their child needs help. They know their child is struggling with something, and it's clear at home that they're struggling with this, but the teacher's not seeing it. And it may impact the student's education. Maybe we're seeing school avoidance, or maybe we're seeing, additional anxiety, depression symptoms, but the teachers aren't seeing it. And so on those school rating forms, the teacher said they're fine, they're average. A school's not going to qualify a student then. And so I just want everyone to be aware, especially the parents out there, that schools are going to prioritize those school rating forms. I don't want to say that the parent forms don't matter, because they do. Of course, we want to see a student's performance across settings, but in order to qualify for special education services, they're really going to be focusing in on the school forms. Again, there needs to be an education impact, right? That's going to be key to qualification in any area we're looking at, is that educational need and impact. But again, there are going to be the developmental and functional needs. So we can't always highlight or can't always focus on the academics, which a lot of schools do. They'll say, oh, well, this student has good grades, or they scored well on the, end of year, end of course exams, or on the state assessments. They're fine. They don't need an IEP. But if it's affecting their developmental or functional needs in school, then that's something we have to highlight and we have to bring to the table as a concern. If we're seeing some social emotional deficits that are impacting mental health, if we have executive functioning deficits that are impacting mental health, because they do, but also impacting their ability to just function and be able to be independent, going from class to class. Social skills, although that's not academic, that is something that all of our kids need to have, is good social skills, because the goal of an IEP, and Ruth kind of hit on this with the transition piece, the goal of an IEP is to be able to transition them out, whether that's independent living, whether that's the workforce, college and post-secondary. So again, if the student's disability is impacting them in any of these areas that's not academic, we still need to talk about them, and we need to consider qualification for those areas. Quick thought on IEE. So an IEE is an independent education evaluation, and that's performed when a parent disagrees with a school-based evaluation. So they have to first disagree with the school-based evaluation, then ask for the IEE, which is going to be at the district's expense. Districts can put a cap on how much they're going to pay for the IEE. Sometimes you can negotiate that depending on the circumstances, but usually they can say it's, we'll allow up to this certain amount. And then once the IE is completed, the district has to consider the findings. But that's really what the law says. District must consider the findings. The district can decide to carry over recommendations into the IEP. What I see most often after a district receives an IEE is they will then agree to a reevaluation or an initial evaluation if that student didn't qualify in the first place. A lot of times we're going to see the school wanting to do their own evaluation to qualify for services and not just take that IEE for what it's worth and everything that's written in it and then qualify a student for an IEP. That's not usually how that works. Getting an IE can make sense in some cases if you feel like the school-based evaluation was just, not it was inefficient, right? It didn't really capture the needs that you saw or the concerns that you had. Maybe it didn't show deficits in areas that were there. That's a time to get an IEE. I would say if the evaluation was, pretty good and it covered, most areas, then I don't know. Sometimes getting an IE can add that sort of extra layer of adversarial relationship between the parent and the district. And it might not always make sense to do that if you really are getting most of what you need on the IEP based on the school-based evaluation. And sometimes it can take a lot of time to get an IEE. So it can delay things if we're waiting on that to really lead into an IEP. All right, scenarios. Where am I at on time? 2:35. Started at 2, right? Okay. So I have 3 different scenarios that we're going to go through. We're going to go through the child's profile, different evaluations that were done, and then talk about, again, in my opinion, this is my opinion, so other people might have other opinions, but what the student would qualify for on an IEP. Thank you, Elizabeth. I have 15 minutes. Perfect. So Adam is a 5th grader, and he was referred to testing due to parental concerns with his work completion in classes, low grades in math, poor scores in the state assessment in math, and overall lack of interest in school. You can see in his cognitive profile that he has really great strengths in verbal comprehension and processing speed. The fluid reasoning and visual spatial skills, those nonverbal skills, are really kind of on that border of below average. And 89 is average. But again, if we're looking at a pattern of strengths and weaknesses, there is quite a bit of a score difference between his strengths and his weaknesses. So we do always want to keep that in mind when we look at a child's profile. And then working memory at an 88, again, is sort of in that, we would say low average, right? The low average range, still average, but not exactly where we want it to be. Academically, his reading skills are aligning with his verbal comprehension as we would expect. His spelling is strong, oral expression is strong. So all of those verbal skills that correlate to verbal comprehension, those are all great strengths for Adam. Unfortunately, weaknesses for him are math. So the math calculation and the math reasoning. His listening comprehension was assessed, and that was on the border. Again, we see the working memory, listening comprehension. Oftentimes those go together because the assessment for listening comprehension a lot of times is asking for a student to follow multi-step directions or hear something, again, to sort of manipulate that and then spit it back out. So working memory is utilized in those assessments. So not super surprising. And then written comprehension, or I said written comprehension again, written expression is on the border. So it's average, but just a few points in that average range, which maybe wouldn't be expected if we're testing Adam. We wouldn't maybe expect to see a written expression score right there. So it's something for us to keep in mind. All right, next slide. His social emotional rating scales from the teacher, they showed some at-risk scores in the areas of hyperactivity, attention problems, study skills, and anxiety. The parent rating scores were clinically significant in the areas of depression, anxiety, conduct problems, and study skills. There were some different areas that were flagged at school and at home. The teacher, though, didn't have any clinically significant areas. They were at risk. His executive functioning rating scale showed highly elevated scores in the areas of planning and organization, working memory, and initiation. So initiation is being able to initiate tasks. We know planning and organization, that makes sense. And then working memory again. So that was in the cognitive assessment. Now it's flagged here for the executive functioning rating scale. Both parents and teachers rated these areas as concerning. So we do see a correlation here on these rating scales between home and school. There was an observation that was done, and he was passively off task 35% of the time during a 30-minute observation in math class. So think about 35%. I mean, the math class was 30 minutes. 35% of the time is kind of high, in my opinion. But he was passively off task. So that means he was maybe looking around, maybe twiddling with something or looking at his paper, but he wasn't necessarily paying attention to the instruction. So what are some possible IEP supports for Adam? If this were a student that I was working with, here are some things that I would advocate for. So I would definitely push for goals in math calculation and math reasoning. In my opinion, that is kind of a slam dunk, if you will. Again, the nonverbal cognitive skills corresponding with the math skills that were below average and well below average. And so that would be easy enough for us to get those on an IEP. Executive functioning, we have those 2 rating scales again from home and school that show deficits in I think 3 areas for executive functioning. And then I would push for some social emotional learning supports. We're seeing sort of anxiety or some mental health components. I think mom's was flagged for depression. So trying to get ahead of that. What we often see for students that are struggling academically as they get older, a lot of times they put a lot of pressure on themselves. And if they are, overall, average intelligence, they think to themselves, why am I not getting it? What's wrong with me? And that really does take a toll on their mental health. And so sometimes the social emotional learning goal, or even having an accommodation where they can check in with a school counselor, something, really focusing on that, I think is really important for a lot of these kids. Now, the written expression supports, a school may not qualify him for a written expression goal because that pattern of strengths and weaknesses didn't really tie in with what we would expect. That's not to say every school district, right? Each school district is different. They may say, yes, this score alone looks like he needs some support. But what I've been doing the past few years is tying written expression in with executive functioning. And that has been, in my opinion, a pretty easy way to get a written expression goal or even a written expression objective on an IEP if a school is resistant. Because we know executive functioning is very important to written expression. We have to be able to, think through again the topic or what we're supposed to be writing about, organize that in our head, plan it, initiate that task, which we know Adam has a hard time doing. And then as we're going through that written expression assignment, being able to sort of check in and think to ourselves, is this aligning with the goal or is this aligning with what the rubric says I have to do? So a lot of executive functioning is involved in that. And then here are some listed accommodations that I think could be helpful. Math manipulatives, chunked assignments, prompting and redirection, movement breaks, adult proximity, and preferential seating away from distractions. Also, Adam, and you have to go back, it's fine. But one additional thought for Adam is when we're talking about qualification, he would qualify under SLD. But like I said, in Ohio, we can look at ADHD characteristics, right? We can't say he has ADHD, but we can say that Adam has characteristics that look like they could be ADHD. He has a hard time paying attention. He has deficits in executive functioning skills. And so a school could say he qualifies under other health impairment, based on the profile that he presents. So again, in Ohio, that's easier. In Michigan, it definitely is not. And we know that. And Pennsylvania, for me, is like a middle ground. So it just depends on the school and the state, but I just wanted to throw that out there for Adam. All right, next scenario. Lisa is a 10th grader and she's always done well in school academically. She's qualified as gifted in the areas of superior cognitive and visual arts. Starting last year, she started exhibiting school avoidance, and that resulted in many meetings between her parents and school to talk about truancy. Lisa loves art and music, but doesn't want to join those classes as she is insecure about her abilities. She typically wears baggy clothing and doesn't take time to do her hair most days. She seems to have one good friend, but isn't seen by school staff to socialize with other peers. She is very quiet and keeps to herself, but will participate if called on in class. The team suspects Elisa has been self-harming lately, and she does go to the bathroom pretty often. She was referred for an evaluation as her teachers and parents are concerned about her mental health. I didn't add this in there, but there was also a suspicion of autism. No, next slide. Thank you. So a cognitive assessment was not performed with Lisa because she scored above 130 on previous gifted assessments and then one outside evaluation that was done in 6th grade. So no need to redo those. We know that she is above average for her cognitive abilities. She scored average or above average in all areas of academic testing previously, so that wasn't assessed either. Looking at rating scales, she did score in the clinically significant range on a teacher rating scale in the areas of anxiety, depression, atypicality, withdrawal, attention problems, social skills, and functional communication. So a lot of areas on that rating scale that were flagged, and again, clinically significant is above that 70. So it means that there are some pretty significant problems here. Mother really scored her average except for depression, which was in the clinically significant range. And then they did do an autism rating scale because again, autism was slightly suspected, and she scored it in the very likely range for autism. And so something that was flagged that maybe we didn't think about before, but she did score in that higher range for social communication and self-regulation. The parent rating score was probable. And sometimes we see that with autism rating scales because parents, again, she's a 10th grader, so parents have seen her for a number of years. And so like, this is just Lisa. But teachers maybe only had her this year. They see that she has some maybe behaviors that would be considered odd, or maybe not fitting in with her peers, things like that. So what are some possible supports for Lisa? I would honestly sort of start with one goal, a social emotional learning goal that would really incorporate social skills training, looking at that anxiety piece and working through those feelings, and really talking about the feeling of overwhelm and sadness. It seems like she has some low self-confidence. She has great abilities, but doesn't really feel confident in those abilities. And so being able to work with a school social worker or a special education provider or both, who would be looking at this goal and working on these skills to really just help her be in a better place and learn skills that she can utilize now in school, but of course in the future as well. Accommodations for her are going to be, kind of minimal because again, she doesn't have a whole lot of needs. But maybe some extended time to complete those assignments. That way, if she's maybe having a bad day or an off day, she can have that extra time. Maybe a modified schedule because we have that truancy or school avoidance issue, and then access to some sort of peer support group or social skills group. Last one is Mr. Marshall. So he is a first grader. He was referred to testing by his mother because he was below average in reading since the beginning of kindergarten. He had been receiving outside tutoring twice a week for 5 months and received small group support in school. But he's making, he's making some gains, but still the concern is there. A dyslexia screener at the beginning of the year determined that he was at risk for having dyslexia, and the concerns that were flagged were in rhyming, phoneme substitution, and identifying letter sounds. Next slide. So this is his profile. So all in all, he has strong cognitive skills, except for that auditory processing. But academically, we can see that all of his reading skills are below average, or honestly well below average. Written expression and spelling also correlate with that auditory processing. And so, looking at his profile, we can see that he probably is struggling pretty significantly in class with the skills that we're seeing, presented with the academic profile. Next slide. Thank you. There were no concerns noted with social emotional development, executive functioning, gross motor skills, or social skills. So all in all, pretty well developed in those areas. There was a fine motor assessment that was done because he does still write some of his letters and numbers backward. That's honestly considered typical until I want to say third grade, I think. So it's not atypical for him at this age, but they still wanted to assess it to see what was going on, and he did score below average in visual perception. So how his eyes sort of perceive and take in information. And an observation showed that he was on task 95% of the time. So really no concerns with off-taskness or any ADHD or anything like that. So he definitely will qualify under SLD, and we would expect him to have a decoding goal, an encoding goal, reading fluency goal, and a goal for written expression. Reading comprehension felt pretty low. I think that was the 55 is pretty low. But sometimes for our students who have a lot of decoding and encoding deficits, it doesn't, thanks Elizabeth, I'm almost done this last slide, I promise. We don't always write a reading comprehension goal because it doesn't make sense, honestly, to have a goal on there to comprehend what we're reading when we can't read. So sometimes we'll have them put in the IEP that the student qualifies for reading comprehension goal, but the team is agreeing at this point in time, we're going to work on, the basic reading first. That way it's noted in there. So next year, maybe he'll do really well with decoding and we can add that reading comprehension goal back in there. The occupational therapist might recommend a visual perception goal. These are some accommodations that I would recommend. Special design instruction with an intervention specialist. I think we need to specify that he requires multisensory reading instruction. That's something that we oftentimes want to put in the IEP somewhere. We can't name a program. So we kind of get around that by using specific language that really is saying he's getting some sort of phonics-based program. But that's something I've been trying to do more when the schools allow me to put it in the IEP somewhere to really list what the program does without listing the program. Okay, and I think that's it.
Thank you, Danielle. We really appreciate it. We have one quick minute and we did have one question. So if you want to touch on it and then maybe get back to it a little later at the panel. Just one of the comments was that oftentimes students with autism struggle with pragmatic language. The speech language therapist is really the most qualified person to address those issues. However, they are a lot of times those SLPs are have so many students that have more of the physical issues of speech, like lisps or that kind
Okay.
of thing, that the pragmatic side of language gets pushed to a social worker a lot. So they were
Oh,
wondering what the best way to address pragmatic language deficits is in terms of
yeah.
academic success. And again, if this is a really long answer, we can talk about it maybe
Yeah,
later.
no, I would say I would go into the qualifications for that staff member. I mean, a social worker, in my opinion, is not necessarily primed and trained to work on pragmatic language. Can they work on social skills? Absolutely. But pragmatic language is usually a specific, area of qualification or area of training that the SLP has. So that's what I would lean into. I mean, a school social worker is honestly not trained to work in that area. So I would pull up, whether it's, whatever the state law says, right? The state law usually will give you a description of that person's credentials or their license. And that's what I would pull up to sort of argue that because SLPs are the person that should be working on pragmatic language. And so I would try to push back on that.
Thank you, Danielle, and thank you again for a wonderful presentation. This is one of my favorites, as you know. Um, Thank you again, everybody, for tuning in. I think in our chat soon, if not already, yep, we do have the session 5 evaluation in the chat. So if everyone could please fill that out. We will be back at 3 o'clock with Mark Weiker's presentation. See you soon.